Bob Williamson here. Julian, I'm surprised to hear you sounding a little bit more negative than you did 20 years ago. 20 years ago, you convinced me that when we had a choice between embryos, that it not only was an ethical good, but it was an ethical obligation to choose what you described as the best embryo at that stage in terms of health. You may remember the sort of situation we discussed was one where a couple wanted to avoid having a child with thalassemia or cystic fibrosis. They had several embryos that they knew would not develop thalassemia or cystic fibrosis, and they had full genomic data on each of those embryos. Is there any reason why they should not avoid using an embryo which, for instance, has ApoE4, which is the major determining factor for Alzheimer's disease, as against ApoE3, which has a very low take of Alzheimer's disease? Wouldn't you still say there's an ethical imperative both on the clinician and on the person who is the couple who are involved to have the healthiest possible embryo all in all, and to use all data available to achieve that outcome?
Yeah, no, I've been writing on the use of whole genome analysis now to expand on what you just proposed. So not only could you look at ApoE4, you could look at all the genes associated with the development of Alzheimer's disease and quite drastically reduce the chances of a future individual developing Alzheimer's disease. But it wouldn't just apply to Alzheimer's disease. It would apply to diabetes, hypertension, stroke, Parkinson's disease. All of the common diseases have varying genetic contributions. And now with the development of polygenic risk scores, where you can sum the effect of hundreds of genes to give risk predictions, you could use this to select the best embryo. In fact, genomic prediction creates a measure based on quality adjusted life years that would be maximized across a range of different common conditions for embryos. So, and you could use AI to augment this. And yes, I do believe there is an ethical obligation to use that if you can agree on the outcomes. So if you can agree on, say, the value of schizophrenia. And so the problem is that in many of these conditions, once you move outside of something like thalassemia, which is a single gene disorder that you mentioned, to polygenic conditions, you have a condition that's called pleiotropy, where one set of genes has multiple effects. So the genes that dispose to schizophrenia and manic depression also dispose to creativity. The genes that are associated with higher IQ are also associated with autism spectrum disorders. So there is going to be a difficulty, and this is the problem, a problem for AI, a huge problem, is that AI will only maximize a value. You have to tell it what value you want to maximize. And so if you say, we want to maximize the number of qualies, it will tell you which embryo will maximize the number of qualies. But that's based on a set of assumptions about the trade-off between schizophrenia and creativity. And I might trade those things off differently. Now, you mentioned ApoE4, and I agree with you. I would probably say you don't want an embryo with E4. However, we don't know what the pleiotropic effects of E4 may be. There may be advantages. And I agree, on the current knowledge, I would go with an E3 embryo. But I think one of the problems for this is going to be disagreements about value. So one of the big problems with AI is that you have to, it's easy if you're just saying what will prolong someone's life. Everyone wants to live a longer life usually. But when it comes to complex trade-offs or contested values, then is the AI maximizing the value that the patient has? Or is it maximizing the value of the doctor or the developer of the AI or society? So I think that is also a big challenge for AI in the future, how to deal with value pluralism. Because when you say, yeah, it's of course we should have a better child, But then what's a better child? Some people with deafness say deafness isn't a disability, it's a difference. So now we need to decide, well, are they correct? You know, is value in the eye of the beholder? Or, you know, for example, intersex conditions. Is that something that we should screen out through, you know, embryo selection, and AI should be programmed to select against it? Those are questions that society seems very reluctant to address. And I think it's going to make it very difficult to use interventions like AI beyond very simple cases.